cut this out of 3/4 felt and pull it in half, and then you have two of them, and you just place them around the patella like that. So now we get the pressure in these low areas at the sides of the patella where the tensor bandage may just span rather than putting pressure in there. So we put these semi-lunar pads on, and then I'm just going to, okay, stand up, and then I can show you just to, yeah, sometimes. I was doing this one time, and the person fell right on the shoulder, flapped out, so I always make sure you know. So, start the tensor down here, and then I can put my semi-lunar pads, and notice, whoop, I'm going to take this thing kind of at a fairly sharp angle here, and I think I mentioned that when you're wrapping, you really don't want to get a lot of pressure in the back of the knee. So I'm going to try and bring this up across the front of the knee, and then around and back down across the front. And you will have some wrapping at the back, but the tension, the compression, is going to be on the front. So around, and then we just do these figure eights. And I try and keep the pressure off the back here. You can see that this stuff is really loose. And I think I mentioned that you really want to keep the pressure off that popliteal space because of the blood vessels that go in the back. Now, this is particularly healthy, is pushing the patella in against the femoral condyles. So, you know, if somebody had patellofemoral pain syndrome, this would not be a good idea to put the pressure straight across. Then you would have to be a bit more careful about it and use the back, and actually wind up doing just the opposite. Try and keep the, when you finish coming up and down here, you would have patella. You should be able to see some of the skin on the patella here to make sure you're not pushing it into the intercondylar groove and cause some discomfort to you. Okay, now we have two ways of doing the patellar stabilization. The patellar stabilization tape job is good for a couple of major issues. One of them is for controlling the amount of excursion of the patella, how much side movement the patella has. And as you probably would know now in palpating different people, the tibial tubercle is in different positions. Some people have it up quite tight, which means that their infrapatellar ligament is quite short, and other people is down, you know, even 1/4 of an inch, which means that the infrapatellar ligament is much longer. If there's some biomechanical issues, then having a longer tendon means that there's a longer tether and that the kneecap can swing more. So what this tape job tries to do is tighten up, and actually instead of having the insertion down here, we push the infrapatellar ligament against the bone and effectively shorten the insertion point. So now it's on a short tether and it can only swing very little, and that will help control it. It would be really good for people with subpatellar pain syndrome with a long infrapatellar ligament, or anybody that has problems with patellar subluxations and dislocations. This would almost be an automatic if you already have a dislocation, and that will help control the amount of excursion that it goes through. Two different ways of doing this. One, I want to do this with the knee a bit bent, so just pick your heel up and just put the heel on a roll like that, and then I would just kind of measure my tape. better to use elasticon tape. It's some tape that's a lot stronger than this. And I'm going to tear each end like that, so I have one of these X's, tape X. And then, because the stuff isn't very strong, it's a good idea just to take this and fold it in behind to the midline and make it twice as thick. Then I'm going to make sure that I identify the tibial tubercle, which is right there, and then the inferior pole of the patella, which is right there. You can see it coming down. So there's the inferior pole of her patella. The tibial tubercle is there, and I want to place that little folded piece in between. I want to actually start it as close up to the inferior pole of the patella as possible. And then I'm going to push you backwards, so brace yourself. And then I'm going to put lots of pressure in there, and then wrap this above the popliteal space and overlap it like that. And I would spray the back while I'm putting this, and then grab the bottom ones and do the same thing. Pull in really hard, but I'm going to wrap these below the popliteal space. Like that. And if I had to use this junky stuff, I would put another one on her because it's so stretchy. Yeah. Yeah, I'll get turn around for a second here and we'll see it. The hardest part of this tape though is actually controlling those goofy little ends. You always want to flick up on it and get stuck together. And just hold it in that a bit thicker. And this isn't great with the elasticon tape, that thick stuff. You don't really have to do this, and it saves the tendency of your little wings here to roll up on you, which is a real pain when you put pressure on it. So I'm going to just position that in between both of them. I'm going to get a real full, it's not too long. And once you attach these, you don't have to put any tension. Just keep the tension on until you attach them onto one another, and then take the pressure off them. Good? Okay, now I'll get you to turn around and face the floor wall. And then remember, this is elastic tape, so I have to take some of these, and because this has been sprayed, this stuff is going to stick down really well.